Average in Ontario of 80% of new moms breastfeed their babies. It's better for bonding, better for the baby, and usually pretty satisfying for the mom. But what happens when a mom who wants to breastfeed can't for one reason or another, and she ends up back in the hospital? It's exactly what happened to the couple we're about to meet, Bonnie and Fernando D'Souza, and their little baby Anthony. Welcome to you both. Now, what's going on right now with Fernando and little Anthony is called finger feeding. Bonnie, tell me what this is.
Well, finger feeding is a method of feeding the baby either breast milk or formula or whatever you want to use when you don't want to introduce an artificial nipple, but you want to continue breastfeeding.
Now, this happened to you too. You had to go into the hospital after Anthony was born. Why was it important to you to continue the idea of breastfeeding with your little one?
I really think breastfeeding is important, and there really is a close bonding period when you nurse your baby, and I just thought it was so important to continue. He gets all the immunities from my breast milk, and I think it's better for him. He can digest it better. How
did you actually do it without going into all of these sordid details? But you extracted the breast milk, and then what did you do?
Well, I extracted the breast milk starting about a month before I went in the hospital. So I had enough. I actually had enough to cover for 2 days. And,
did you know in advance that you were going to need to do this? Or
yeah.
This was okay.
Yeah, I did. Unfortunately, I couldn't get too much breast milk extracted because as you're extracting, he needs to eat it and stuff. But and then when I was in the hospital, Fernando fed him through this method my breast milk.
And you kept it frozen, I guess, before you would use it?
Yeah.
So let's take a look at what that method really is. I don't know whether John can get in there. But can you take the finger out, Fernando, so we can see what it actually looks like? So it's just a little hose.
And you just make sure it's just at the tip of your finger there, so he doesn't end up sucking a tube down his throat.
He's looking for it. He's looking for it. And then Anthony actually, if you will, sucks on your finger, but gets the milk.
Siphons it out of the bottle, yeah.
The whole idea is to keep the tongue depressed and forward, so it simulates the mother's breast, and the tongue should be between the gum and the finger.
This is great. You know, we always talk about equality in every aspect of life, and this is it for you. Now, what was it like for you? We've talked about bonding and how important it is for a mom to bond with a new baby. What about for Dad?
Well, I never had a chance to feed him. This is the first chance I had to feed him because we didn't want to give him a bottle, and I don't know, it feels good. I like, they feel helpless, and I really enjoy feeding them. It's something he really wants.
Where do you think the bonding comes in? Is it just the closeness, that the time that you spend together in this position?
Yeah, I think it's the closeness. The time we spend like this. He's, he looks up at you. You're feeding him. You feel like you're really satisfying him, and
you spend more time with the baby too because it takes longer for him to get the milk than with a bottle. He'd get it so quickly, and a lot of mothers that feed bottles tend to prop the baby on a pillow or whatever and just prop the bottle up. And this way, you're forced to have close contact, and I mean, you want to anyway.
I would think that this would be a great idea for couples, no matter what the circumstances.
Yeah.
I have a friend whose wife gave birth on Sunday, and this might be a great idea for Peter to get involved in the nurturing as well.
They say it's good for babysitters if you have to leave your baby with somebody, or
it doesn't have to be the father.
Relatives, anybody. Just make sure your hands are nice and clean.
Is there some sort of training program that you can't just buy the equipment and do it yourself? No. I would think that in the hospital that you were encourages this too.
Kitchener-Waterloo Hospital, yes, and also if anyone in Toronto wants to have some sort of demonstration, they can go to Toronto Children's Hospital, breastfeeding clinic, and but you can do it for anything. If the baby rejects the breast for any reason, or is too sleepy to take the breast, you can try finger feeding, or some babies will have be born with a cleft palate, and this will help to encourage.
I still like the idea that Fernando, the dad, is in there breastfeeding the baby. That's great. Great party talk too.
Yes, it is.
Thank you both for joining us.
And
little Anthony as well. He's been our best guest.
Yeah.
So articulate. We're going to head into the City Pulse newsroom right now and check in with David Onley.